Good morning. I will now begin on a discussion on the case study of Teck Chye. I will start with a brief background of Teck Chye. He was diagnosed with neurogenic bladder disease and meninocele in his early childhood. He then struggled with the need to use a catheter in order to discharge his urine. This actually gave him many problems since young, which we will discuss on later. He then suffered from urinary tract infections and had end-stage renal failure in his early 20s. He was required to be on renal replacement therapy, but he chose a more conservative management due to financial constraints. Our group has drew up this eco map, which identified a few factors including his father, his friends, social worker, doctor, school, and bakery. I will now go on to explain about the different factors. On the left column, it shows the strained relationship that Teck Chye has with the few different factors. Firstly, Teck Chye has a strained two-way relationship with his father. He felt like a burden, especially concerned with his financial burden to his father, who is the sole breadwinner of the family. He thus tries to keep his expenses low, but his father, on the other hand, felt that he was lazy and misunderstood his intention to stay at home. Next, Teck Chye has a strained relationship with his friends and schoolmates. Due to his condition, he had some restraints which resulted in friction with his classmates during his schoolwork. So this resulted in even more misunderstandings between them. Teck Chye also has a strained relationship with his medical doctors. This is because he was recommended to do a hemodialysis, but he refused due to some personal constraints. Okay, next, Teck Chye also quitted school in hope to help with his family expenses. It may also be likely due to his strained relationships with his schoolmates and classmates that resulted in him making this decision. So after quitting school, he actually worked in a bakery which he had to quit after 3 years due to problems with coping with work at the bakery. This may be due to his medical condition, where he had to insert the catheter, which will disrupt his work. So, while having strained relationships, Teck Chye also has some positive relationship with the social workers. So now my group mate Shamini will go on to talk about the positive relationship.
In view of the various issues that were mentioned, the roles that the social worker can take in assisting Teck Chye and his family would be firstly to provide practical assistance in the form of financial assistance, such as applying for medical subsidies, for example, Medifund. Furthermore, the social worker can provide information about different services that are available, for instance, a support group for Teck Chye or his family members, as well as referrals to other organizations that could provide relevant services. Also, in view of the stigma that he is experiencing, counselling can be done to provide him and his family with emotional support and work towards the goal of improving his coping patterns, considering the importance of the ecological perspective. The biopsychosocial model should be considered in addressing the psychosocial typology of the illness. Educating Teck Chye and his family members about the illness and interventions provided would help them to prepare psychologically as well as emotionally. Hence, it is important for the social worker to allow for self-determination, such that while information is shared, Teck Chye and his family members' views and decisions should be considered without imposing of the professional opinions of the social worker. Also, it's essential that Teck Chye and his family are included in the processes of decision making, such that the intervention process would not be disabling but empowering and client-centered, whereby Teck Chye and his family members can have a sense of ownership. I'll now pass on to Zhong Jie, who will share about the limitations of the social worker's roles.
While the social worker has the ability to manage Teck Chye's issues, as mentioned above by Shamini, the social worker as an individual cannot effectively treat one problem without addressing the cluster of problems. As such, an interdisciplinary team is recommended to provide a long-term, holistic package of care for clients who have multiple and complex needs. This is to ensure the efficient division of labor in the different dimensions of care. In Teck Chai's case, the doctor would be the best person to provide medical knowledge and advice about his medical conditions, as well as his treatment options and the consequences of the treatments. A psychologist can step in to provide counseling for Teck Chai to improve on his self-esteem, as well as his self-determination and will to carry on fighting in his chronic disease. When Teck Chai's self-image improves, he may then foster better relationships with his family and friends. In view that the social worker cannot provide direct intervention for Teck Chai's work at the bakery, the social worker could either refer him to the Community Development Council for available employment opportunities, or the social worker could work with an occupational therapist who can help Teck Chai with his occupational functioning when his dialysis leaves him weak and tired. The integrated care that an interdisciplinary team provide not only promotes the effective use of resources, but the service user, who is situated at the heart of services, will also feel empowered and supported to make his own decisions in the course of his painful treatments.
Recognizing the importance of various psychosocial factors that may influence Teck Chai's illness prognosis, it will be beneficial for Teck Chai to receive other forms of psychosocial support on top of his biomedical treatment. This can be given by psychologists, occupational therapists, and as well as the medical social worker. This is, of course, will be utilizing the interdisciplinary team perspective, but there are problems with utilizing this approach. Firstly, there could be a conflict between the doctors as well as the allied health professionals. This is because of the different background training that each professional has received. For example, the doctor may be emphasizing more on the biomedical perspective, while the allied health professionals may be focused on the psychosocial aspects. One solution would be to always be mindful of the usefulness of the biopsychosocial model and to understand the importance of all three factors and to be able to integrate all three factors within the treatment scope. A second issue could be a feeling of disempowerment from the individual's perspective, such as Teck Chai. This is because of the number of treatment and as well as support services that is presented to him using this approach. Hence, we should also be mindful to empower the patient by allowing him or her to be able to ask relevant questions and to be able to make the right decision. At the same time, Teck Chai may be undergoing home-based dialysis, and therefore this suggests that there could be two different teams, such as one at the hospital and as well as one working in the home. So therefore these two different medical teams and support teams should be able to communicate with one another effectively through appropriate procedures as well as coordination plans. One problem with the ecological perspective is that one cannot assume that as long as there are adequate factors that provide good support, the client will be well taken care of. This is because of the nature of the ecological perspective, which we all know as the dynamic nature, which suggests there is an interaction effect between the individual as well as his or her environment. For example, Teck Chai experienced stigma. What is stigma? According to Goffman, he defines stigma as a spoiled identity and for an individual feeling being deviated from normality. Hence, how do we treat stigma? This is to firstly, we have to target the individual's belief, his attitudes towards achieving what is normal. So, starting from the individual, he needs to be able to understand and accept himself, accept his condition, as well as be confident that he can be able to perform normal day-to-day routines. And the environment can step in to help him, such as medical social workers to be able to counsel him and at the same time provide information that he requires about his condition. And at the same time, his family and friends can also play a useful role by accompanying him for his daily activities, such as watching a movie with him or having a meal with him, and allow the patient to be able to accept that he can still be as normal as other people and perform day-to-day activities like them. In conclusion, our group feels that there is not one best perspective that we should utilize or focus on. Instead, we should integrate both the ecological and the interdisciplinary team perspective so that Teck Chye will be able to receive the best and holistic care he can receive. Thank you.